you very much.
So, good morning, my name's Dan.
My name's Jodie.
And we're here from the Dementia Crisis Home Treatment team from Medway Community Healthcare in Kent. We're here today to pitch our quality improvement initiative for the introduction of telehealth technologies in our local care homes. We would like to pitch for the full amount of £5,000 to purchase 3 Docobo computer handsets at £1,734 each, to be tested over a 12-month period. So, what is Docobo?
So, Docobo is a telehealth care system that uses a handheld computer to communicate with ourselves and a care home that's connected to an app. The device is able to monitor a patient by setting up alerts and tasks for the care home to complete. The device is able to record and monitor things like blood pressure, pulse, sleeping patterns, pain, infection status, behaviour and mood. It can even take an ECG. The device also has the ability to show pre-loaded training videos on different tasks. This will upskill the care home staff. The information that we collate on the devices will then be used to monitor the patient more closely and for the team to respond as appropriately, trying to eliminate the situation turning into a crisis and possible admission avoidance.
So, why do we want to do this? Well, we want to support our care homes in managing behaviours of concern. We have 57 care homes in our local community and who make regular referrals, duplicate referrals and have multiple services involved with no collaborative working. We even receive referrals that don't meet our criteria due to lack of staff knowledge and inexperience with dementia. This takes up valuable resources and time which could be used in a more effective manner. One of the queries that we get from a lot of care homes is that they don't feel supported by community services due to lack of collaborative working. We hope by having the daily tasks and alerts set up, the care homes will feel more supported and that they will get the support in quicker from various services. We're hoping to see that Docobo brings better quality referrals, a better quality of care, stronger collaborative working between professionals. We're hoping that it will upskill care home staff and have a more ergonomic use of time for staff within our team, with the end goal, of course, better patient outcomes.
So how are we going to evaluate and measure our success? We will use both qualitative and quantitative methods to gather data. We have identified 3 out of the 57 care homes in our local area which we would like to trial the Docobo system in. We would place 1 handset per care home, which would then allow up to 5 patients to be monitored. On the slide is some of the questions that we would like to ask, but obviously there are some other things that we would like to know. Things like whether or not the technology has been used to upskill the staff, whether or not we have avoided a possible admission to hospital, have we made a difference between us and the care homes? And there are some others. The data will be collected, by 1 allocated member of staff within our team, and our administrator will collate the information we are gathered. We hope that this will reduce the inappropriate referrals to our team so that we are able to work more actively with clients that need our help. We also hope that this will reduce multiple service referrals as well, because one of the things that happens to us is we get a referral, our community mental health team gets a referral, and so does the GP. And we want to try and prevent that from happening. We want to work more collaboratively. So the end result being a more collaborative working approach between us and other services in our community.
So, once again, to summarise, we are bidding for £5,000 for the purchase of 3 Docobo handsets. With this quality improvement initiative, we are expecting to see both financial and time-saving benefits. When previously trialled in a care home in Swale, the home felt more supported and staff felt they had been upskilled. Patients were also provided with a better quality of care.
Thank you for listening. Have you got any questions?
Thank you very much indeed.